Well, in general, women go to the doctor often, especially when they're pregnant, but most men, get this, wait until they're at least 50 before scheduling their first appointment. I think that's shocking, insane. Today is why guys should take a cue from the gals when getting checked out.
Yeah, I think this is a great point that our next two doctors, guys themselves, are making. Dr. Matt Johnson and Dr. Peter Leonovicz are both board-certified urologists with Aurora Healthcare, and they're joining us today just after Father's Day. I think this is a great point to make, to put a focus on men's health. I mean, what is up with guys? And the other thing that I've read is that very often the appointment, even that first appointment that they made, is made by somebody else, like their wife. Yeah.
That's exactly right. And thanks for having us on. We're happy to be here again. But and appropriate after Father's Day, I think that we talk about men's health. You know, for years, women have had such a great opportunity to talk about women's health when they have early appointments for their gynecologists, even before they have children. And then they have this long relationship with them. They usually see them every year. Well, as you know, men, they don't usually have their first problem, urologic problem, maybe until they're 50 years old. And they're often very private, and they don't usually seek their first appointment with the doctor. So most of their appointments are made by their wives or their significant others or something like that. And they, so, you know, these things don't often come up until they're in their 50s or even later. So it's very important.
Yeah. I mean, I can think of, in my mind right now, I can think of several men that do not see a doctor regularly. In fact, maybe I'm trying to think if they have since they were kids. And I think that's a common thing that a lot of women, a lot of wives out there are saying, yeah, my husband doesn't go. So in terms of urology, and as the both of you being urologists, what is it about a urologist that a man should seek out? Why should they come and see you? And what exactly do you do?
Well, as urologists, although we see both men and women, a large percentage of men's health issues are directly related to urology. These include prostate enlargement with associated urinary difficulties or urinary incontinence, kidney stones, bladder issues, sexual dysfunction, infertility, as well as cancers involving the kidney, the bladder, the prostate, and the testicle. When men or patients get referred to urologists, it's usually by their primary care provider, and men aren't all that great about following up, as we've talked about, with their primary care doctor. But if a man follows up for his routine annual physical exams, his doctor is much more likely to pick up on these findings that would suggest underlying disease and refer him on to a urologist. And as urologists, we're not only trained to treat these diseases, but we're uniquely skilled at asking the right questions and picking up on subtle findings that might indicate underlying disease, from which point we can carry on and offer diagnostic testing that might detect cancer or problems in its early stages where it's more treatable and curable.
Well, I'm glad you brought that up, because it's the reason why women get regular mammograms. Men also should be getting a regular PSA test. Both of you specialize in robotic surgery, and prostate cancer, for example, is very easy detected with the PSA test, especially in year-to-year comparisons. But you guys have done more of this type of surgery on prostate cancer than any other physicians together in the state. And I think it's worth pointing out to men and women out there who are going to make the appointment that if you catch it early, it's so much more treatable, curable, it's so much better for the patient.
That's right. And a lot of these things require, you know, a certain kind of dialogue and sensitivity with the clinician. And that's what our goal is in the office, is to provide an environment where some of these barriers can be taken down for that honest discussion to happen, and for men to talk about stuff that they're generally not all that comfortable talking about, perhaps. And the other thing that we want to really emphasize is how much these issues will affect the entire family. Not just the men themselves, but also, you know, their spouses, their children, and their, you know, their extended family as well. So that's to be emphasized, really.
In a perfect world, what age would someone first come to you, a man first come to you for an appointment?
Well, there are new recommendations for screening for prostate cancer, for example, which starts now at age 55. But more importantly than even coming directly to a urologist, we would like to encourage patients to establish with a primary care physician. We need men to take responsibility for their health care for not just their urologic problems, but their blood pressure, checking their blood sugars, looking at cholesterol levels, all of these other things that are very important. And with a good primary care physician following all these things, they'll detect these urologic problems and send them on to us appropriately.
Yeah, the category of men's health really starts with with the primary care physician.
Yeah,
but
that open
you have to be
dialogue.
able to engage with your doctor and just talk about them, which I think is, probably the first obstacle is, hey, let's talk about the stuff that I don't usually talk about.
When I think you guys make the point that fear keeps a lot of men from just visiting an office, fear of a hospital visit, for example, and also men comment on having trouble fitting schedules into their busy schedule. I think men are more involved with children and their families than ever before, and just like women who are trying to balance work and family, it's tough to make those appointments and get there.
Yep.
Yeah, it's good.
Absolutely.
You have this seminar that's coming up. Both of you are going to be there facilitating this, and this is an opportunity for people to hear from you, to ask questions as well, and this is free.
Right. So this is a unique opportunity for men to just be in an audience and talk about, or hear us talk about some of the men's health issues and sort of frame out what is included in that category. And there'll be an opportunity for there to be some interaction, some questions to be answered. And it's a free seminar. It's going to occur next Tuesday. And we're excited about it. We've not done something in exactly this venue before, or this type of talk before, but it should be, really helpful for men who, find it interesting.
And women.
Attend.
We want the women to attend this as well, because we understand that you guys drive what we do. So, so what the women say is important for us men. So.
Absolutely. Right. So you saw the information there on your screen. Next Tuesday, the 25th at 6:30 at Southridge Mall Community Room. That's on the second floor with the Aurora Quick Care. Here's how you can register for the event. It's 888-863-5502, or you can visit them online to register at aurora.org/events. Again, free men health seminar. Thanks so much for being here, gentlemen.
Thanks for having us.
Great
Thanks so
conversation.
much.
Appreciate it.